Thiazide diuretics are a group of drugs used to treat hypertension and anemia. They promote diuresis by blocking the sodium chloride co-transporters in the kidneys. In this visual mnemonic video, we'll give you an easy way to remember the characteristics and uses of thiazide diuretics. On a hot summer day, who wouldn't want to spend the afternoon relaxing by the pool? Check out this girl lounging by the poolside. She's quite the fashionista. Even in the summer, she's wearing such fashionable thigh-high boots. These thigh-high boots should help you remember thiazide diuretics. Get it? Thigh-high boots for thiazide diuretics? Thiazides are a class of diuretic that consist of drugs like hydrochlorothiazide or HCTZ, chlorthalidone, indapamide, and metolazone. Now that we've anchored ourselves to thiazide diuretics, let's start by learning how these drugs work. Oops, you could say this pool boy got a little too distracted by this beautiful fashionista. He accidentally tipped his food cart over and a salt shaker fell into the pool. This salt shaker could remind you of sodium. Also, the pool should help you remember chloride, since pools are filled with chlorine. Together, the fallen salt shaker contaminating the chlorinated pool should help you remember that thiazide diuretics inhibit sodium channel co-transporters in the kidneys. Because now, both the salt shaker and the pool are ruined, right? These sodium chloride co-transporters are responsible for the reabsorption of sodium from tubular fluid. Specifically, sodium chloride co-transporters are located in the distal tubule in the nephron. We don't exactly have a symbol to represent the distal tubule. However, to help you remember it, there are two pool tubes way in the back, out of our scene. You can even call them distant tubes. These distant tubes can help you recall the distal tubule for test day. The end result of blocking sodium chloride co-transporters is an increase in urine volume and a decrease in blood volume. We'll learn more about the diuretic effects of these drugs soon. For now, let's continue learning more about the mechanisms by which this works. The first ion that is affected by thiazide diuretics is easy. We'll just use our fallen salt shaker to peg it. Recall that salt is our recurring symbol for sodium. And it should be obvious how blocking the sodium chloride pump would reduce sodium reabsorption in the kidney. Blocking sodium reabsorption also prevents water reabsorption, since where sodium goes, water normally follows. This is one of the main mechanisms by which we lose more fluid in the urine, in a process formerly called diuresis. Next, take a look at this fallen banana sandwich our pool boy was carting. Must have fallen down with the cart tipping over. Bananas are our recurring symbol for potassium, since bananas have a lot of potassium, right? So the fallen banana here should help you remember that thiazide diuretics decrease potassium reabsorption. Why would drugs that block sodium chloride pumps also decrease potassium reabsorption? Well, in a response to decreased sodium, our body senses this lower fluid volume and releases more aldosterone in a compensatory response. Aldosterone stimulates sodium-potassium exchange in the distal tubule, increasing sodium absorption in exchange for pushing potassium out into the urine. The end result is excretion of more potassium in the urine and a decrease of blood in blood potassium levels. Nothing completes a hot day at the pool like a cold, sweet treat. Take a look at the ice cream that our fashionista is eating. That's a lot of ice cream there. Notice specifically that our ice cream cup even has a little cow on it. It's the calcium ice cream, get it? This calcium ice cream should remind you of calcium, since ice cream is full of calcium, right? And our fashionista is raising her many scoops of ice cream here to remind you that thiazide diuretics increase calcium reabsorption and blood calcium levels. Recall that the sodium chloride co-transporter is located on the apical, or top membrane, of the epithelial cells lining the kidney tubules. When thiazides inhibit this transporter, sodium levels inside the cells decrease. This stimulates sodium-calcium antiporters in the basolateral or bottom membrane to increase intracellular sodium levels by reabsorbing calcium. Don't worry, this mechanism isn't too important to remember for test day. Just keep in mind that thiazide diuretics increase reabsorption of calcium. Now that we've covered the basics of thiazide diuretics, let's get into the clinical uses. If we want to understand why it was so easy for our pool boy to slip and lose control of his food cart, just take a look at the pooling water on the ground. Of course there's water everywhere, since the ground by pools is always wet and slippery. But this pooling water should also remind you of diuresis in the treatment of fluid overload. And we've already learned thiazide diuretics help decrease blood volume through diuresis, or the loss of fluid in the urine. The resulting reduction in fluid volume reduces blood pressure, which can improve symptoms in fluid overload states. Thiazide diuretics are often used to treat cases of fluid overload, like heart failure, pulmonary edema, and cirrhosis. In these settings, the loss of fluid volume can provide symptomatic relief, like clearing fluid from the lungs to help patients breathe better. This should make intuitive sense, so let's just move on. Next, take a look at this pool floaty over here. Specifically, notice how it's deflating or letting out pressure. The deflating pool floaty is our clue for decreasing blood pressure to treat hypertension, one of the main clinical uses for thiazide diuretics. Since deflation is just a reduction in pressure, right? As we described earlier, thiazide diuretics inhibit sodium reabsorption, causing a decrease in blood volume in the body by losing more fluid in the urine. This reduction in blood volume, in turn, causes a decrease in blood pressure. Thiazide diuretics are therefore one of the initial treatments for essential hypertension in outpatient settings. It's worth noting that, in contrast to treatments like beta blockers or ACE inhibitors, thiazide diuretics are not first-line treatments. This is because while those drugs have been proven to reduce mortality with hypertension, thiazide diuretics have not. Also, it's worth noting that thiazide diuretics can also be used in the treatment of nephrogenic diabetes insipidus, or nephrogenic DI. In case you don't remember, nephrogenic DI describes an inability to concentrate urine caused by defective ADH receptors in the collecting ducts of the kidneys. Now, you might be thinking, don't thiazide diuretics cause diuresis? Well, actually, thiazide diuretics have a paradoxal antidiuretic effect in nephrogenic DI. As we've learned, thiazide diuretics decrease blood sodium concentrations and cause mild hypovolemia, or low blood volume. To compensate for these changes, sodium and water reabsorption is stimulated in the proximal tubule. This results in a decrease in fluid entering the collecting ducts, causing an overall conservation of fluid. Because of this, thiazide diuretics can actually improve symptoms in nephrogenic DI. Finally, recall how our calcium ice cream represents how thiazide diuretics increase calcium reabsorption in the distal tubule. This increase in calcium reabsorption can be harnessed in a variety of clinical situations involving calcium balance. For example, these drugs can help treat osteoporosis and have been associated with increased bone mineral density. For this reason, thiazide diuretics are especially preferred for the treatment of hypertension in patients who are at risk for osteoporosis, like postmenopausal women. Thiazide diuretics can also be used to treat idiopathic calciuria and calcium oxalate kidney stones by reducing calcium excretion in the urine. Now that we've gone through the main uses for these drugs, let's move on to some side effects. Someone had taken out a device to help inflate the pool floaty, but it looks like the distracted pool boy just ran over the device and completely broke it. We can even see lithium batteries spilling out of the broken inflator. These lithium batteries should help you remember increased lithium toxicity, one of the potential side effects of thiazide diuretics. In case you don't remember, lithium is a drug used for psychiatric reasons, with a physical structure very similar to sodium. Like sodium, lithium is mostly reabsorbed through cation transporters in the proximal tubules. As we've mentioned, thiazide diuretics decrease blood sodium concentrations. To compensate for this loss, sodium and lithium reabsorption is stimulated in the proximal tubule. This increases blood lithium levels, which can lead to toxicity in patients taking lithium for bipolar disorder. Just picture these lithium batteries to remember that thiazide diuretics can increase lithium toxicity. Yikes! The pool boy has even run over one of the guest's feet with his cart. Our poor guest now has an injured, swollen big toe. This inflamed big toe is our recurring symbol for podagra and hyperuricemia and gout, because the severe redness and swelling of the big toe really resembles the podagra or tophi in gout, right? As a result of blood volume decreases, thiazide diuretics can stimulate an increase in proximal tubule reabsorption. This can cause hyperuricemia, which results in a buildup of uric acid crystals on joints and precipitates an acute gout attack. Next, recall how thiazide diuretics decrease blood volume to treat hypertension. Well, it should be pretty easy to rationalize that you could go too far in the other direction, causing hypotension or low blood pressure as a side effect. This is super obvious, so we're going to skip ahead and move on. The next few side effects are also really obvious. Thiazides can cause multiple electrolyte abnormalities like hyponatremia, hypokalemia, and hypercalcemia. We've already covered how thiazides decrease sodium and potassium reabsorption, while they increase calcium reabsorption. You can then infer how these can lead to low sodium and potassium or high calcium. Don't spend time memorizing a laundry list of facts when you can infer them from the mechanism. Connecting the dots is how you'll get that high score and really understand the material for test day. Another potential effect of excess diuresis and hypovolemia is upregulation of aldosterone, as we've already mentioned. This aldosterone then acts on the kidneys to increase hydrogen ion excretion. This increased loss of acidic hydrogen ions actually leads to metabolic alkalosis, which is typically termed volume contraction alkalosis or simply contraction alkalosis. This is not high yield for step 1, and is more of a thing your attendings will pump you about on wards. Contraction alkalosis is a common effect of all diuretics, so it's not going to help you pick thiazides out of a list of other diuretic agents on test day. In general, you should just think back to your physiology and how aldosterone works to remember this one. All right, we're almost finished. Before we go, there's a last side effect that we should mention. It's worth noting that thiazides carry a sulfonamide group. This means that thiazide diuretics are technically sulfa drugs, which can cause allergic reactions in people allergic to sulfa medications. Next, thiazide diuretics can cause metabolic abnormalities, such as hyperglycemia and hyperlipidemia. We didn't symbolize these side effects because, from our perspective, it's really hard to write a question about hyperglycemia caused by thiazides. The mechanism is unknown, and this side effect is also exceedingly rare. It's far more likely that you'll get tested on lithium toxicity and hyperuricemia. I would focus far more attention there to maximize your yield for test day. All right, that's it for thiazide diuretics, so let's summarize. Thiazide diuretics are a class of drugs that include HCTZ, chlorthalidone, indapamide, and metolazone. Thiazides work by inhibiting the sodium chloride cotransporter in the distal tubules of the kidneys, increasing the excretion of sodium in water and inducing diuresis. Thiazide diuretics lead to decreased sodium and potassium reabsorption and increased calcium reabsorption from the urine. Clinically, thiazide diuretics are used for inducing diuresis to treat fluid overload states, like heart failure and pulmonary edema. The reduction of blood volume is also very useful in the treatment of hypertension. Thiazides can treat nephrogenic diabetes insipidus by stimulating sodium and water reabsorption in the proximal tubule. Finally, because thiazides stimulate calcium reabsorption from urine, they can reduce the risk of osteoporosis and treat calcium oxalate kidney stones. However, thiazide diuretics do have some adverse side effects. For example, these drugs can increase lithium levels to increase the risk of toxicity. Secondly, thiazides can cause hyperuricemia, precipitating an acute gout attack. Okay, Now we're actually done with the thiazide diuretics. We should probably step in to help before this pool boy causes any more accidents. I'll see you in the next video.